Hello. Have you heard of the term facelift, but you never quite understood what it meant? You thought, oh, it's something that celebrities get. It's not really relevant to me. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore. And today we'll talk about facelift surgery, how it can help reverse the effects of aging, and it is something that could be of benefit to you. Now, facelift is basically a procedure that is done to reverse facial aging. It's done to make the face look younger. But before we understand a facelift, we have to understand facial aging itself and understand the changes that happen in the face as we get older. So firstly, there is some sagging. Because of the effect of gravity, the skin starts sagging. So you start getting lines in this area, you start getting some folds in the lower part of the face. The whole face starts looking more saggy. Second thing is changes in volume. When you're young, your face is like this, it's like a V. As it gets older, it becomes more squarish. This is because volume in the upper part of the face around your eyes starts reducing, and volume in the lower part of your face around your jawline starts increasing. This is what leads to the change in the shape of the face. Thirdly, there is change in skin quality. So a skin that is nice and elastic becomes thin and crepey, almost tissue paper-like, particularly around the eyelids. You start getting these eye bags. Fourthly, you start having muscle changes. You start getting wrinkles. Wrinkles in the forehead, wrinkles around the eye because of repeated muscle activity. So this is some of the changes that happen as you get older, and this is what we're looking to address with a facelift. Now, what are the various treatment options available for these aging changes? Broadly, they can be classified into non-surgical treatments and surgical treatments. Non-surgical treatments include Botox, fillers, thread lifts, lasers, and these are all very good. They all have great benefit. But one, they have a limit to how much they can do. So in very advanced facial aging, they do not work very well. They're good for early aging signs. Secondly, they don't last very long. They last for around 1 to 2 years, not more than that. Their advantage, of course, is that they are not surgeries, so there isn't too much recovery time associated with them. Surgical treatments give a much better benefit. They give much more dramatic results, and their results are also long lasting. They can last for up to 10 to 15 years. The disadvantage is, of course, that being surgical procedures, they have some amount of recovery time. One of the examples that we're talking about today is a facelift. So now we finally come to the question, what is a facelift? It's in the name. You're trying to lift the face, you're trying to correct the sagging, give a tighter, younger appearing face. So with this, we're looking to lift the face, we're looking to add volume with fat grafting, we're looking to improve the appearance of the eyes, we're looking to improve the appearance of a neck. These are all various things that can be done during a facelift. That does not mean that everyone requires every one of these. Each patient is different. The patient is analyzed and it's decided what all options of a facelift is required for that patient, and then the decision is taken. Now, who is a good candidate for a facelift surgery? Typically, facelift surgeries are best done in those who are in their 50s and 60s and 40s. Younger patients in their 20s and 30s, they don't have advanced facial aging to require a facelift. In the 30s is when you start doing non-surgical treatments, those work very well. In the 40s, typically, non-surgical treatments might not be enough anymore, especially in the later 40s. In them, that is when you start considering surgical procedures. Problems happen when you try to give a surgical result non-surgical. You might have often seen that some celebrities, as they get older, they start looking a little weird. Face looks very puffy, lips look very, very thick. This is because too much non-surgical work has been done. The sagging of the face, you're trying to correct that by pumping the face full of filler, and this does not work. Sagging requires a different treatment, not filling. So, both non-surgical and surgical treatments have their role, and the right patient has to be chosen for both of them. So let us look at this patient, for example. This patient is clearly an example for a requirement for facelift surgery. This level of jowling, this level of lines, this level of hollowness around the eyes, non-surgical treatments won't work very well for. It will also not be cost effective. You'll have to do so much non-surgical treatment that 1, it will be far more expensive than any surgical procedure. 2, it won't give a good result. 3, it won't last very long. So what are the benefits of this surgery? This surgery can improve your whole face from top to bottom. You can improve the eyebrows, lift the eyebrows up with the brow lift. You can make the eyes look better with the blepharoplasty. You can make the face look better with fat grafting. You can lift up the sagging face. You can tighten the sagging neck. All of these are the benefits of a facelift procedure. Now let us quickly go over the surgery itself. This is a simplified version just to help you understand. So in a facelift surgery, typically there is an incision in front of the ear. It comes from the hairline and runs down the groove in front of the ear. If you're doing a neck lift also, then the incision also goes behind the ear and it goes up into the hairline. So this incision is for the facelift. This incision is for the neck lift. In a facelift, after this cut is made, the skin is lifted up. So this space is dissected on the face. Then we're trying to tighten the tissues and structures inside the face. We're trying to lift it up in this manner. That is what we are aiming to do in this surgery. And the way we do that is by sutures. We use stitches to tighten the tissues inside the face. Once this is done, the skin automatically gets lifted up. So then some extra skin in this area is removed. And then it is put back and closed with a stitch line in that area. This was the facelift part of it. Now we can also look to improve the neck in the patients who need it. Typically when the neck is very saggy, as you can see, it can be like this, whether it's called a turkey neck. And we're trying to make it nice and tight like this. For this to happen, we either make an incision over here or we just make an incision behind the ear, like I mentioned. If a lot of work needs to be done in the center, then this incision below the chin might be required. So if we do this incision, what we do is we're trying to get rid of these bands in the center of the neck, and that is done by stitching the muscles in the center. So these are the stitches that would be done. This is just to show you what's happening on the inside. The entire neck is not opened like this. That was the neck lift. The third part of this is fat grafting, wherein we're looking to replace lost fat. That can be done in the under eye, in the upper eyelid, in the nasolabial lines. This is done by harvesting some fat from your stomach and injecting it with very fine cannulas. You can see more information on this in our video on fat grafting. So what is the recovery after this surgery like? This surgery is done under general anesthetic. You're admitted in the hospital for one night. So if you do the surgery today, you go home tomorrow. When you go home, there is a bandage on the side of your face like this. You feel pretty okay within 3-4 days. You can start walking around, working on your laptop, doing small works within 3-4 days itself. We typically remove the sutures around 7 to 8 days. For you to show your face to someone and people not to know that a surgery was done, that usually takes around 2 to 3 weeks. What happens during this time is that there will be a lot of swelling after the surgery, and that swelling takes a little bit of time to go away. Some people might also get some bruising. Bruising means like some reddish marks in the under eye area. Everyone doesn't get this. If it does happen, it will take around 2-3 weeks to go away. You start seeing the result week on week, month on month. Full result typically takes around 6 to 8 weeks. Now obviously the next question is this a safe surgery? Are there any complications? This is a very, very safe surgery provided it is done by the right person and it is done correctly. Now any surgery, there are complications which can happen. Let us talk about them. They can be of two types. One, those which are complications after any surgery, and specific complications related to a facelift. Possible complications after any surgery include infection, hematoma. These can happen after any surgery anywhere in the body. The chance of them happening is very, very low, but it is not zero. When done correctly with all proper precautions, the risk of this happening is less than 0.1%. Now, specific to a facelift, what we are worried about is causing any damage to any facial structures inside the face. This depends on two things. It depends on the technique that is being done and it depends on the surgeon who is doing it. The technique that we do, we are not going anywhere near the facial nerve. So that kind of injury is not possible. It is possible with some more aggressive varieties of facelift, which is usually not required in most patients. The second part is if the facelift looks artificial. That is what people have a concern about. When done correctly, you don't even realize that this surgery was done. This again depends on the surgeon, and it's important that they know what they are doing. How effective is the procedure? When done correctly, as I said, you don't even know about it. The best facelifts are the ones that no one knows about. You might have seen some photos of patients with very stretched faces. That is like the tip of the iceberg. Most patients have a natural result and it is very hard to make out. Think of your favorite celebrity. You know these celebrities that people say, oh my God, they look so good even in their 50s and 60s. They have all had facelifts. It is not possible to have a very strong jawline, a very young looking face at that age without this. So, when done correctly, it gives a very, very pleasing result and a natural result. Now, the next question is, how long does the result last? It's important to understand that this procedure will make you look 10, 15, maybe 20 years younger. But ultimately, we're turning back the clock. We're not stopping the clock. So, your face will continue to age. It's not that what happens after surgery will be the same even 30, 40 years later. It will change, but at any point of time, you will be younger, you will look younger than what you would have without the surgery. So here we can see one patient who had a facelift surgery. This is her photo 3 weeks after the procedure. So she still hasn't gotten the full result yet. But you can make out that she's got a nice strong jawline after surgery, which wasn't there before. And the entire face looks much more smoother and much more tighter than before. This is the incision after the surgery. You can see it is running down in front of the ear. It is very, very hard to make out when it is sutured well. And here you can see the neck part of it. The neck is much more smoother. The skin isn't as crepey and as wrinkly as before. Now, this was a very simple explanation of what a facelift is. There are various different kinds of facelifts. I trained in Belgium with Dr. Tonard and Dr. Varpal in the short scar facelift or the max lift. I trained with Dr. Rorik in USA for a full face and neck lift. So there are various techniques and we analyze the patient and decide what technique would suit each person. Some person might just require a short scar facelift. Some person might require a full face and neck lift with a blepharoplasty, with a brow lift. So the customized plan is done for each and every patient. I hope you found this video beneficial. Do like, share and subscribe to our channel. Let us know in the comments about any other videos you'd like to see. If you have any doubts, get in touch with us. Our information will be on the screen. Thank you. Have a great day.